And welcome back to the morning show. Here we are, Dr. Bellew down at Mohave Skin and Cancer in Laughlin. And it's good to see you again,
Good to see you, Bruce. Thanks for having me. Doing great.
Anytime. Hollywood been calling you?
No. I wish. No, that would be nice.
Really? I think
Yeah,
you changed
nothing.
your number or something. Because they're calling me all the time saying, where's that guy we want for a movie? So, you know, there's been great advancements in medicine, step by step, in just about all facets of it. And certainly dermatology is no different. But you were telling me a little earlier, before we started the shoot, about some vitamin that's supposed to help prevent skin cancer?
Yeah, that's correct. So
A vitamin?
Yeah, it's pretty neat. So, patients all the time are coming in talking to us about, is there something I can take over the counter that's not prescription that I can use to prevent, skin cancer? And so there's a study that came out of Australia. This is from 2 years ago.
Let me get this door here. There we go.
And this actually study was published in the New England Journal of Medicine. And it was basically where you had two treatment groups. And this was at multiple centers in Australia. So it was multi-centered. And it was placebo-controlled, meaning you had one group that basically took a saline pill, or basically a placebo pill that had no medication in it.
Right.
Then you had another group that took basically what's called vitamin B3, which is nicotinamide, which is a 500 milligram dose they were taking twice a day. And so this other group was taking the placebo twice a day, but they didn't know that they were taking the medication. And so the patients were basically people that have had multiple skin cancers or have had multiple pre-cancers in their lifetime. And what they found was basically that over a 1 and 2 year time frame, these patients that took the nicotinamide, which is a vitamin, actually they had less pre-cancers, less skin cancer, they had less surgery from that. And I'm not recommending that everyone take this, kids or things like that. We don't really recommend that. But people that have had multiple pre-cancers that have been treated with liquid nitrogen, or people that have had multiple basal cells or squamous cells, should be on this over-the-counter medication.
So that's kind of being directed towards me.
No, yeah,
I'm
just hinting a little bit, maybe, if you want to add this.
Yeah, no, that's true. I mean, because I don't think it just stops at whatever my age is. That I'm going to be encountering this the rest of my life.
Well, as we get older, the other thing is that our body's immune system cannot break down the UV sun radiation and break it down to a point where you have less sun damage. So your immune system weakens as you get older, which leaves you open to skin cancer. You can't repair the DNA damage that's there from the sun. So that's why as we get older, we tend to get more skin cancers. And so, in this age group, these are people that really could benefit from this over-the-counter. And the beauty of this is it's vitamin B, so it's not absorbed by the body, meaning if you take too much, it's not going to cause a problem.
Okay.
But if you don't take in enough from your diet, which most people do not, you're not going to get the benefit. So the supplement is usually recommended. It's a 500 milligram dose, and if people come in and want to see us, we usually recommend that for people with multiple skin cancers and history of pre-cancers.
Are there any known medicines, any prescriptions that your doctor might prevail upon you that would conflict with B3?
Not really. I mean, there's really not a lot of interactions between, now niacin, which is given to people that have high cholesterol, can cause severe flushing and redness. This is different. This is nicotinamide, which is a little bit different vitamin. And this should not cause the flushing that you normally get with, say, a niacin. So that's the big concern, is that if people are going to go over to get this over the counter, do not get the niacin. You want to make sure you get nicotinamide, which is vitamin B3, and you can get that on Amazon.com. You can get it at any health food store. And usually before starting it, we recommend you talk to your doctor or talk to us with dermatology before you start something like this.
Well, wait a minute. I was doing the niacin, and then my wife found one that doesn't make you flush out. Might it be this?
It's possible. We'd have to kind of look and see what they use for you. But yeah, this should not have the same flushing effects as a niacin would.
Okay, good. We'll have to check that out.
Yeah, so
at just about any store or online.
Yeah, you can pretty much, and it's fairly cheap to get. Usually most people get it in 90 to 180 tablets at a time. And it's a pretty good supplement for people with multiple skin cancers.
Fabulous.
Yeah.
Of course, that doesn't stop you, ladies and gentlemen, from understanding that you can get it no matter what you're taking. It could be hereditary. It could be any number of things. Too dang much sun. Whatever it is, you always want to come in at least once a year and get checked. And if there's a problem, then they can kind of get on and take care of it before it gets completely out of hand.
Definitely.
Thanks, Doc.
Thanks, Bruce, for coming by.
Always
Appreciate it. Good to
Thank
see you.
And there you have it. Those are the tips of the day. We'll be back with more of the morning show right after this.